Hi, I'm Dr. David Cheng. In this segment, we're going to be looking at airway dentistry. What is airway dentistry and how does it affect you? Airway dentistry is looking at your breathing-related issues that may affect you in your sleep and also when you're awake. How does breathing-related disorder affect dentistry? Breathing-related disorder can cause erosion on the tooth structure from good. It can cause changes in the bite and the joint position and also the muscles from sleep bruxism and awake bruxism. It can cause inflammation on the gum and the bone from obstructive sleep apnea. Breathing-related issues are quite different when you are asleep and when you're awake. When you're awake, the airway muscles are a lot more tighter. When you're asleep, those airway muscles are more flaccid, they're a lot more looser, therefore they will fall back into the airway and it can affect the airway if you have an compromised airway. In this part, we're going to be looking at breathing-related issues when you're awake. The body maintains a very narrow range of pH between 7.35 and 7.45. The optimum is 7.4, which correspond to a partial pressure of carbon dioxide of 40 millimeter of mercury. Anytime when the partial pressure of carbon dioxide changes, that can affect the pH in the body. And as a result, there may be symptoms and deficits that may result from the change in the pH. Anytime when you breathe hard and fast, you're causing a disruption in the mechanical aspect of breathing and the chemistry of respiration. What causes the partial pressure of carbon dioxide in the body to change? If you breathe really hard and really fast, you will be getting rid of carbon dioxide. As a result, you could be getting into what we consider to be a hypocapnia state. When you're in a hypocapnia state, you could experience certain deficits and symptoms. For example, you could have muscle fatigue, you could have chronic fatigue, you could have asthma-like symptoms, you could have tingliness in the extremities, you could have attention deficit disorder, you could also have mental fog. When you breathe really hard and fast, you disrupt the mechanical aspect of breathing, which is moving the air in and out of the lung, and the chemistry, which is the exchange of carbon dioxide and oxygen. Now, the body itself has a natural reflex. The idea is that you have to train so that you can find your own natural reflex to get out of the hypocapnic state. If you have any issues with nasal breathing, you may be breathing through the mouth. When you breathe through the mouth, you may be activating the jaw muscles. As a result, you may be having issues of pain with jaw joint and also pain on the jaw muscles as well. You may also experience hypocapnia state because you may be kicking out the carbon dioxide at a much more faster pace. We all have anxious moments. When we have anxiety, we tend to breathe using our chest versus the diaphragm. By doing chest breathing, we tend to activate the accessory muscle, including the jaw muscle. As a consequence of that, we may be having pain on the jaw joint and the muscle itself. How do you solve dysfunctional breathing habits? You may have to look at your natural reflex. However, natural reflex is not that easy to find for some individual. You have to go through some self-exploration phase of your own breathing. Then you need to have some training, which is a self-intervention, and then eventually move into what we call a self-regulation. Second is that we want to try to look at nasal breathing versus mouth breathing. There may be some issues that you may have with nasal breathing in terms of anatomy, so you may have to have a little further study done on that in terms of getting, let's see, a CVCT to look at what the structures of the nasal cavity is going to be like. The third is that you want to be able to do diaphragm breathing versus your chest breathing. At this point, I'd like to thank everybody for watching the video. We will discuss furthermore on this topic in the future videos. Thank you. And if you have any questions, please contact us at www.drchengs.com.